it's so funny. First of all, it's funny to hear you say April because it sounds like you're a narcissist talking about yourself. That you brought showers
I
and
mean, it
you're the
is my
one that
month,
you're the
right?
one that flowered spring. Well, we both have birthdays in April, okay? But we didn't both get named after our birthday month.
This is On Call.
Wow, this would be really cool to just wear scrubs all the time. Then you don't have to think about what you're going to wear to work.
Joke is awesome.
We're here to answer your questions.
We can sit down and discuss them. Wait, I gotta go. I'm on call.
Wait, you're on call? I thought I was on call.
Welcome back, everyone, to another episode of On Call with April and Alicia. I'm April.
I'm Alicia, and it is May again.
It is still May.
It's still May. It's got to be May.
That's true. But you know
And
what?
it's
Our
it's
May
not-
has been, you used to always hear that that phrase, April showers brings May flowers. And I
Yes.
don't think that's necessarily true anymore.
Really?
Our
Why?
May-
Is it still raining?
Yes, our May has been so much more rainy than our April. Like we've had just rain and rain for days, it feels like.
April, it's so funny. First of all, it's funny to hear you say April because it sounds like you're a narcissist talking about yourself. That you brought showers.
I mean,
and
it
you're the
is my
one that-
month, right?
You're the one that flowered spring. Well, we both have birthdays in April, okay? But we didn't both get named after our birthday month.
That's true.
But yeah, I it's funny that you say that phrase in particular because it made me think about when I was in school, we had this book of it was like riddles.
Mhm.
And I'm going to give you the riddle that has been in my brain since April. Ready? If April showers bring May flowers, what do May flowers bring?
What's the answer to the riddle? I guess whatever you want.
Pilgrims.
Whatever you say. Oh, pilgrims.
I-
Oh.
In the middle of the night, I will say that to myself. If April showers bring May flowers, what do May flowers bring?
So
And I
this
don't
is
know.
something that's like instilled in you from like childhood
Yes.
that you just
Yes,
constantly
it's
think
like
about?
randomly speaking French to my children. It's like it's buried so deep that it just comes out.
That's
So
really funny
anytime
that we
anyone
both are
says
thinking
anything about
this statement.
April, what'd you say?
I said it's funny that we're both thinking about this statement. Like I was just thinking like yesterday, I think they're gonna have to change it to May showers bring June flowers because this isn't true anymore.
It
So it's
is,
really
well,
funny that we're
it
both
is-
thinking of it.
It's funny that you brought it up and you were really breaking it down like that's not true. Whoever wrote that is a liar. And I was breaking it down like, do you remember that funny riddle?
No, but I
That's
feel
what it
like
made
my
me think
kids
about.
told that around, Thanksgiving time when they were kids, probably. Like when they were
Yeah.
younger.
What do Mayflowers bring? I'm like, June drought? I don't know. Death of flowers? Because it gets too hot? Nope, pilgrims. Oh,
Well,
speaking of flowers, you would be proud. First of all, what'd you think of my flower setup that you tried to make fun of me?
well, okay, so one thing I'll say is that the picture wasn't as bad as I anticipated, but I also almost sent you a video that came up on my Facebook the other day because it was this person who had the exact same setup as you, like on their porch, they had these two pots, and instead of putting dirt in them, they took a pool noodle and like curled it up and put it in the bottom of the pot, and then they put the plant that was still potted in the whatever they bought it in and just stuck it on top. And I was like,
Yes.
oh, maybe that would look better for Alicia versus her Amazon boxes in the bottom
Well,
of the
you
pot.
can't see that boxes because I at least poured dirt on them. So it looks like it's full of dirt, but you'd be even more proud of me because not only do I don't just have one concrete huge flower pot on my porch. I have two additional, and I put one out in the yard, actually filled it with real dirt so that it doesn't get blown away by a storm. But I've got flowers around my house. Not that I did it before, I just didn't have a lot. I mean, I pretty much, it looked pretty sterile. My mom came over the other day and her comment to me was, oh my gosh, your house finally looks like a home. I was like, do you mean like the
That's
inside?
a sign
Like,
that
I
you
was
had
so
not
like,
done
what do you mean?
anything outside.
At all. At all. It's pretty sad. So
Oh.
yeah, I did
Well, We get
I
lots of
think so.
compliments on the front of our house because I mean, the year that we moved in, we just planted, oh man, I always mess up annuals versus perennial. I guess it's annuals because you
Annuals don't come back.
annual. Okay, so we planted perennials, and so they come back every year, and they come back bigger every year. So we don't have to do anything; they just come,
Uh,
like they just grow. And everybody's always like, "Oh my God, your house looks so great." I'm like, "Yeah, we didn't really do anything to it because we
but you
just
still have to like cut them back and that kind of
well,
fancy
we cut them
stuff,
back
right?
every like the end of the fall for the winter, and then they grow back. And I mean, we have to weed a little bit, but not really a lot.
You know what bothers me about yard work? All of it, but the most not about yard work is um I don't know if you've ever experienced moles. This is a welcome to the April and Alicia Garden Show. Um, have you ever experienced moles in your yard?
No.
Okay, well, me neither. Till last year, I had no idea what was happening. And I would walk out, the kids would like go out to play ball, go do something in the backyard or the front yard, and they would just be, I'd be like, where all this dirt's turned up. You like walk on, you could see these like tracks. Now I know exactly what they are, but at first I was like, what the heck? So something said in my brain, mole. I'm sure that we've had mole before. Our dogs used to like dig these huge, we had the Great Danes, but they would dig these huge holes into the ground and pull moles out. But the yard was so squishy you really couldn't even play ball because you'd break an ankle. It was the weirdest thing. And I was like, well, how do you get rid of them? And somebody said, well, you have to trap them. And I was like, how do you really get rid of them? Because I'm not trapping them. Okay.
Well, even if you
Uh,
trapped it, then what do? Kill it?
well, that's my point. I was like, trap it, and then what? They're like, you just put a trap at the top of the mound that it comes out on, and then you trap it. But these like little things, they're the grossest. I'm sorry, pet lover. I don't really know what to tell you about this one. They don't have eyes. They look like a frog had a baby with a rat and maybe some kind of a vole, right? And they use their hands are like webbed, so they use it to they basically swim in the dirt. That's why you get that
Mm.
track, and they look for grub. So what happened? What I learned this year was I didn't treat the lawn for grub and
Oh, so you
insects.
had
So
grubs?
everybody around my neighborhood did, except for me, I'm guessing. So all of the mold just came to my yard. And it has been quite, I have had all different ways of how I've had to learn to treat them. But the most helpful thing, Alicia's gardening corner of the day, is just to treat your lawn for insects, and they will eventually go away. But it tore my yard up. When I mean tore it up, I had to like reseed. It was
Oh,
pretty bad.
geez.
Those things are gross. They're the grossest thing I've ever seen in my life, April. I'd rather see Punxsutawney Phil, the little
Mm.
liar. Yes.
Yeah, no, we treat our yard. The only thing that digs in my yard is Baxter. He goes into my flower bed around my shutout back and just digs. So I have to watch him so I catch him.
Yeah.
There's like two spots that he digs, and I'm like, stop doing that.
He probably senses that mole. Ugh,
Oh, oh.
probably hanging out under there. Gross. Just get
No,
rid of
we
all the
treat our
bugs.
yard. There's rabbits. We have rabbits in our backyard.
I have a ton of rabbit in my backyard now, but I don't know if that's I don't know why, but spring maybe. And one of them was so big, I really thought it was a groundhog. I was like, that is huge. I was like, that is a rabbit. That rabbit is eaten very well.
I'm
That's all
sure.
I'll say. Yeah, I think we're
Should
turning
plant a
into the
garden
nature
for it.
channel. Last episode, we were talking about bear.
I
So,
know we are.
but we're talking about
Every
bugs.
episode,
We can
it's
talk
like a
about
different
bugs.
nature thing. All right. Well,
Moles
we
like
can actually
bugs.
talk about bugs today because May is Lyme Disease Awareness Month. So
Yeah.
this I thought this, and we also talked on our spring episode about how I had always kind of thought that the peak season for ticks is in the fall, but it's actually now. Like it actually starts in the spring and goes through the fall. So and you've had a recent
Yeah.
experience with your family. So I thought this would be a good topic for us to start with today. How's that
Yeah.
sound? All right.
Yeah. Look at you.
I know.
You're taking the wheel now. Okay. Captain April. That
That's
sounds
right.
great. Let's do it, as April would say.
That's right. You got to say, let's do it. All right. Well,
Let's do it.
let's
Well, what if
start
I just
with
tell
your
you about
story.
I was
How
gonna
about
say,
that?
if I just tell you guys about Maddox first. It's taken me a long time, I think, to get to I mean, you walked through this with me. It was a
Yeah, there
long
was
journey, you
a
know?
lot of updates here and there and
Yeah,
different
and
thoughts of what it
still
was.
It's so funny when we were thinking about talking about this episode that just remembering all of them. Gosh, all of the pieces. Wish well anyway, yeah, so we talk about ticks. I'll say that I want to say about April of last year. April into that May, Maddox got really sick, but he had COVID. So his COVID test was positive. And he's always just been a healthy kid. Um, if he gets sick, he bounces back fairly quickly. But when he gets sick, he gets sick. Um, he had COVID. He had these like prolonged symptoms, like what we expected with COVID anyway, sleeping. He had a ton of abdominal pain. Abdominal pain seemed to be his biggest thing. He was starting to lose weight. But his COVID didn't affect him in a GI way, meaning he didn't have like diarrhea or vomiting. He was COVID positive, runny nose, cough, that kind of thing, fever. But these symptoms lingered and it got a little bit better. But he was always tired, just wanted to sleep all the time. This is a kid who played every sport, plays every sport, 5, 6 days a week, has practice and or a game. And he just was spending a lot of time sleeping. And he would come home from school, sleep. And he would come home April, I think I'd tell you times, like it'd be like 4:30. He would go to bed. He wouldn't wake up till the next day. He didn't want to start not wanting to go to practices. And then I took him into the doctor because I was like, something is going on. And, we were looking at all these different things. And it was just very benign. Thought it was like a post-COVID syndrome. And then he went to a lacrosse game and they had to pull him off the field because he was having chest pain. So we took him to Children's, which we've been blessed to have Cincinnati Children's here. He was EKG was normal. I think his like said rate was up a little bit. And everything was fine, but they thought that had suspected that he had myocarditis, which was bizarre. But then we thought that was post-viral, like a COVID post-viral issue, and that had been seen, I think, with other variants. I'm not sure what the current variant is, but he had the post-viral myocarditis. We went and saw cardiology, and then we got some blood work, and his white count was really low. His monocytes were really high. His lymphocytes were really low. He had a acute drop in his H&H. When we were like, what is going on? We go see the heart doctor. They're like, yeah, just myocarditis. It's probably from COVID. And then now we're going to see a hematologist. And we pivot into
Making
this.
your rounds.
Yeah. I was like, now they think he's got like at first, I think we were thinking the worst. Like it was lymphoma. It was,
Yeah, I remember when you had said that.
Oh, that was horrible. And this is spanning, for context, this is May, June, July, that all this is going on. Yeah, we can't figure it out. You get a little better and then something else. And the hematologist said, hey, we'll keep an eye on his blood work. They did do a repeat. His white had dropped a little bit more. He was just almost like borderline neutropenic at that point. But they really kept saying to us, it's post-viral, post-viral. We see this with infections. And I'm like, man, COVID, it was so long ago, though. Are we seeing this with it? So his doctor said, oh, it's like maybe he needs to go to this COVID clinic because we do have that, like a the COVID syndrome clinic now at Children's.
Mm-hmm.
And we were planning on that. But the belly pain was persisting. He was still losing weight. We got to see a GI doctor. That was, we finally got in. Now this spans the end of his school year and then the beginning. So now we're into the September and we go see GI and they're like, they think he's got irritable bowel. And his pediatrician, God love her, she's always just been that person who goes, something just doesn't feel right. And I love her because she's great at talking to the parent as the patient as well. I don't know if I'd be that good all the time, but parents have to be the patients. We can only, sometimes we're the only historians for our children.
Right.
But he was able to share it, and she was just like, it's really bothering me. She's like, I really want to do an ELISA test. Maddox spends a ton of time outside. And he fishes, he hunts, he's always in the woods, he's always in everything. And sure as poop, this kid's ELISA comes back positive and he is confirmed with Lyme. And his we believe, going back to that April, May, that was his initial presentation. And what's weird is, when we'll get into this, was we talk about this a little bit more, but the rash, I like in hindsight, he had a rash, but I kept associating everything with COVID because he had a positive COVID test.
Right.
So that was like that's the long short version of of what we went through with him. But it was one of those things that in practice we always heard about Lyme. I started hearing about Lyme a little bit more with when I got into practice, but like with patients who had exposure young, and there's just so much confusion. It's still confusing to me. Does it go
Yeah.
dormant? Does it not go dormant? Like, does it reactivate? Can it be cured? Is it really cured? All of these questions. But I never saw it. It was almost just like the um like Sasquatch, like it's
Right.
something that everybody talks about, nobody's seen. And that's how I felt. And when he was positive, I was like, oh my God, it's real. Like that was my first thought. And I hate to say it that way, but it was. I was like, that's a real thing. I just
Yeah.
thought it was getting to be, some of these things that we can hear about that you're like questionable diagnosis and in the non like traditional medical spaces. But yeah, it's real.
It
And
is real.
it's been a lot for us to digest. And I still, even while I'm talking to you right now, I don't even know if I fully understand it. So yeah.
Well, I think there's also just so much like, I mean, I would controversy is not really the correct word, but like there's just a lot of debate around it, like whether there's really chronic Lyme versus there's not, there's
Right.
um so I think that's part of it is that there's just still a lot that's unknown, honestly, I
Yeah.
think about it.
Yeah. But I mean, if we talk about how we get it, how do we get it?
Yeah,
How do
so
Maddox
we
get it?
we get it from tick bites. So Lyme is caused by bacteria,
Yep.
Borrelia burgdorferi. I can never say that. Even in
I was
peaceful, I can never say
wondering
that.
if you were going to be able to say that.
So that bacteria infects us, but we get infected from ticks that are infected. So the black-legged ticks, or they're also known as deer ticks. So there's the
Mm,
Axides scapularis. And then the western side of the world or the country is the Axides pacificus. But they transmit the infection of
yeah.
these ticks. So they bite you, and they actually have to be on you for more than 24 hours to infect you. Um,
Oh, wow. That's something I didn't know.
oh, really? Yeah. So I mean, Lyme disease is actually preventable by just one, like and we'll talk about this later on, but by watching out for ticks, and if you see them, getting them off quickly because they do have to be on you for about 24 hours in order to
Yeah.
infect you.
I did read somewhere there like there was some comment somebody said ticks are efficient but they're not fast, right? So that's
Right.
probably what they were referring to there was that it takes some time for that. And then they release this spirochete, right? That spirochete comes
Right.
out, burrows to the tissue, and then you start having these systemic effects, which is I mean, it blows my mind as we're going to talk through this, how much Maddox had every single one of these, and no one, and we live in on the East Coast, right? Like Midwest,
Right.
but
I mean, we live where
it's
it's very
Northeast,
prevalent. Yeah.
Midwest, Pacific Northwest, like that's where they're commonly found. Um, we're right in that zone, and amongst 5 acres of woods.
Yep. Well, and
So
I mean, the thing is, you don't even have to be in the woods. Like
yeah,
we've had
true.
them from just going to somebody like a neighbor's house who has a few trees in the yard and sitting out back by the fire pit, and then we'll find them.
Wow.
Yeah. Or like we go to like a cookout and the kids are out playing in the grass, and in the yard, and we've had them. So there's been several that we've pulled off of the kids over the
That's
years.
I knock on wood. I don't think I've ever had a tick on me.
I don't think
And I'm
I've
proud of
personally
that.
had them, but the kids have, so we've
I
pulled
think
them
there's
off.
probably because
But
I have garlic in my blood and garlic and vinegar because I love vinegar so much.
maybe.
That maybe that's the cure. Here we go. But so 470,000 people, I think they say, a year are diagnosed. But can you imagine how many are either unreported, not diagnosed, or misdiagnosed, right?
Oh, I'm sure
That
there's a
just with
bunch.
our experience, and I would never trade my treatment team for the world. I think they're the most brilliant people that we ever worked with. It just, given presentation and given the presence of another virus, I don't think there was a lot of reason for them to assume Lyme. It's very interesting.
It is interesting. Well, so
Well, like,
talking about symptoms, like, so
yeah,
usually the early signs and symptoms, so that's anywhere between like 3 to 30 days after the bite. It's a very general symptoms, as you mentioned, like,
yeah,
so you get the fever, the chills, headache, fatigue, muscle joint aches, you can have some swollen lymph nodes. And then the rash is, the
yeah,
erythema migrans rash, which is, classically it's called like the bullseye rash, like, or a
yep.
target, right? But it doesn't always appear like that. And it can actually appear anywhere on the body. So it's not actually necessarily where the tick was that the rash happens. Like you could get bit one place and the rash can be a completely other
Yep.
place on the body, which I think also throws people off. But you can also not have the rash. Like you could, some people have symptoms but don't actually get the rash.
Oh, well, so, okay. We're speaking of rashes. I'm throwing you a curveball. We're gonna do the spot that rash. Okay, spot that
Yeah.
rash game. Quick fire. I'm gonna give you four scenarios. You tell me, is this Lyme-ish, limey-ish, or not? Right?
Uh-huh.
You have a red circle rash with central clearing after a camping trip.
Yeah, it could
Is
be.
that could okay? Would you be concerned about that rash? Should you?
Given the history, I would be.
All right. What if you get bright red itchy bumps all over your legs after playing in the grass?
No.
Right. That's probably what, a contact
More
dermatitis
of
or
like an
trigger bites
irritation,
or
like an allergic
yeah.
reaction to something, or yeah.
Right. I threw a funny one in here. You have ketchup stain on from a hot dog on your leg. That's not a rash. That was a joke. But multiple ring-shaped rashes appearing days apart.
Multiple, like in the same area, you mean?
Yep.
Yeah,
But they
I would.
rings, but different. Like could be the trunk, the back, multiple ring-shaped rashes.
Yes.
That is and you're right. But what I learned was the bullseye. And Maddox didn't have a bullseye rash. The rash that I mentioned earlier, he had these rings, but it when I think ring, I'm thinking perfect circle, or so, and what they were oddly shaped, but ring shaped on his trunk and on his back, and they came and they left, and we were told that is a sign of early disseminated Lyme.
Yep. Yep.
So yeah. Anyway, sorry, I wanted to do something funny with the rash because even it
No, I
being
think
in
it's
this
good because
field, it like blew right by me.
yeah,
I don't know.
yeah.
Like if it had been classic Target rash, I may have thought about that. I still don't know if I would have. I don't know. And then as our kids get older, the other part is, or they're more private. So
Oh
there's
yeah, we don't see the
rashes in
skin.
places that we don't get to see.
Yep. Yep.
Yeah. All right. Well, how do we
Well,
diagnose this bad boy?
so then you diagnose it by, well, signs and symptoms. Obviously, we look at you got the rash, then that is kind of like a slam dunk in the
Well, the
beginning.
signs and symptoms are kind of funny because it's like, you're exhausted and you're achy and you're annoyed, like they're irritable, whatever. And I'm like, that is all the signs and symptoms of being a parent. Also,
Oh
just
yeah, of
kidding.
everyday life. But I think as it goes longer without being diagnosed, you'll have other symptoms like, severe headaches, you can get some neck stiffness, you
Yeah,
can get some facial palsy where you got some drooping on your face, you have more joint pains, heart symptoms, like you had mentioned, Maddox had chest pains, so kind of
yeah.
palpitations or irregular beats, some dizziness. So I think is those, but again, those are still pretty generic stuff. But
And the belly
so
stuff, I found a study that's actually one of the first things I looked up when he was diagnosed because I was like, its manifestation, it was so like abdominal focused. He had other things, but it was his weight loss and his abdominal pain, and it was just crampy, and it was like no change to bowel habit, nothing like that. But it affects that mucosa. And
yeah.
it's actually there's a couple cases. The ones that I found, they were diagnosed because of abdominal pain. They had either colonoscopy, like upper or lower endo, and with sample, and
Yeah.
they were like, "Oh yeah." There, maybe we'll share this in our on our Instagram page next week. Some of the photos. I think it'd actually be really interesting for people to see what like what the inside. It was like cobbled, is what it looked like on the inside of the gut. So
It is interesting.
Yeah. It basically can cause anything. It's what I'm
Yeah,
learning.
sounds like it.
Yeah.
But yeah, so in general, so you can make a clinical diagnosis, but then also there's the lab test, right? So you do the antibody test, which can actually be false negative in the beginning
Yeah.
when you're first infected, and so it's, you need to wait a certain period of time for it to be positive um, to see it. But that's kind of the definitive diagnosis, and then in terms of treatment, it's antibiotics, right? So, and the course and how, what you take and the course of it really varies based on, if you have allergies, things like that. So, those are determined by your provider when you see them,
Right.
and they prescribe that treatment. But like I
In
said
Maddox's
earlier,
case, I'll share, we did doxy. We did a full 21 days of doxy, but I really wonder at points like, um, especially when things become a little bit more systemic, there's some data that says like having some IV therapy
right.
is beneficial early, but we did all PO, um, and like a lot of rest and hydration, really.
Yeah. Well, and the other thing to point out too is that, I think that people always ask, well, if I had a tick on me, do I need antibiotics? And we don't usually like preventively put you on antibiotics just because you had a tick bite, but certainly if you had the tick bite and then you have the symptoms, then you would do treatment at that point.
Yeah, and you know what? You can get Lyme again. Did you know
Yeah.
that? Yeah. So past infection doesn't give you a lifetime of immunity. You can repeatedly get it, and I understand that it's largely the adult female tick. So if anybody's out there good at identifying tick gender, stay away from the women, I guess. I don't know what to tell you.
I don't know that anybody likes to get that close to ticks to figure that out, but
Well,
um
funny that you say that because they have numbing agents in their saliva. So you don't feel them. That's
yeah,
why we don't know they're there.
they're sneaky little guys and
Just
girls.
like mosquitoes, little,
Yep.
but it is
But
treatable, especially if it's caught early, right? Like that's
right. Well, and we talked too that it's preventable, right? So,
right.
when you're outside, you're going to be out hiking in the woods, things like that. You can wear clothing that covers you so that you don't get them. Make sure that you check for them when you come back in. You can also wear insect repellents that have DEET in them, that will kind of keep them away from you. But really, it's just being aware of it and watching out for it to prevent
Right.
it.
And before we close, I think this is the area that I still struggle a little bit with is really, do we active infection, lingering symptoms? Does this thing go dormant? Does it come back out? What did you learn in that part?
Yeah, I mean, I think most of it is just still up for debate at this point. I think some people do really truly believe that there is a chronic Lyme disease and it can last a long time, but then there's others that don't. So
Yep.
I think time will tell.
And I think what
Um,
they're suggesting is it's a biofilm, that you can have biofilm or like the bacteria can create a biofilm, which makes it hard for antibiotics to penetrate. What's interesting is his doctor actually gave us it's called like it's a chronic illness form. It's basically an FMLA form for school because she says it can be reactivated by other viruses. And they can determine at some point if you need extension of antibiotic, but that can only be within a specific amount of time. But yeah, they're like, I had a hard time finding anybody to like really drop the hammer on, yes, this goes away 100%, or nor this becomes like a chronic lifetime infection.
yeah.
Well, that was a morbid way to end it, huh?
Yep.
So
good
stay inside,
discussion.
everybody. That's our advice.
That's right. Stay inside and clothed up.
That's right. Well, and I think there's a lot of information here. I kind of think we could have talked a lot longer. There's a lot of information here. I think some stuff we will put up on our post around the time this show launches. Just some like reference and some of the things that we talked about today. But you can actually find us and follow us there on Call with April and Alicia on Instagram. You can also find us on LinkedIn. And if you are the emailing type, and somebody better email us soon, or we're going to get rid of this email address. It's oncallpodcast@soundphysicians.com. Please let us know, show ideas, feedback on shows. We'd love to hear from you guys.
Yep. And until next time, you guys stay well and we'll stay on call.
And
Bye,
you stay
everyone.
away from ticks. Bye, everyone.
That's right.